This is the cross-border scheme which started on Monday of this week, which allows patients to access surgery if they've been waiting more than 2 years. They will pay for it in the Republic, and then they will get reimbursed the cost of the scheme, or reimbursed the amount that Northern Ireland would have paid for the procedure here once they produce that receipt. It is good simply because we have atrocious waiting lists. Anything that takes people off our waiting lists has to be a good thing. So not only enabling people to be seen who have been waiting in the Republic, but also the hope that it will free some capacity in Northern Ireland as well for others to be seen. But it does have the two inherent weaknesses. The first being that unambiguously, you've got to be able to pay for the procedure to start with to then get the reimbursement. So it will favour those that can pay. And the second weakness, which there's a significant amount of uncertainty about, is the aftercare for patients, which can be simple aftercare in terms of wounds, prescriptions, sick lines, and so on. But also if complications arise, and we know that complications arise from procedures, and what actually happens to the person, and where we can access help in those circumstances. Yeah, I mean, I think this is just an extension of a two-tier system. It's something in general practice we've seen for years. If you have private insurance or you're prepared to pay, you will get seen. If you can't pay, you will wait and wait and wait, and you will suffer as a result. So I think we've got to be honest about our health service, that it is a two-tier system. It's actually a three-tier system, because we have some elderly patients who will never get seen and will unfortunately pass away before they get any procedure or any intervention. Yeah, I mean, the big thing is that we absolutely need to invest in the health service in Northern Ireland. We need to build capacity. We need to build sustainability. We need to support and retain our staff here. We are losing too many staff, and if we lose staff, we'll never be able to provide the solutions within our own health service.